What's up? How y'all like our low-budget special effects going on right now? This is not a smoke screen. This is actually a humidifier. And I just want to point out, and at the end of the video, I'll really point out what people can do to reduce their risk of transmitting a virus within a indoor facility like my office. Why we've had no cases traced back to my office is one of the reasons likely is because we're using the science and a humidifier. I'm pointing at the humidifier. I reference science. Science is what I'm going to give you that shows humidity actually substantially reduces the infectivity, aerosolized viruses in the air, the infectivity of viruses on surfaces, as well as reducing the surface virus percentages. So it's a great thing to have, especially during the winter months, you know, given that coronavirus and influenza viruses are primarily spread through aerosolization, which they used to say wasn't an issue, and now the science says it's definitely the issue. And of course, they want to argue that masks are necessary, but yet the most recent research studies coming out are now saying that masks, and I'll give you the reference for this, actually can increase by decreasing airflow through your sinuses and airways, by decreasing the speed of airflow through your respiratory tract, can actually increase the deposition, the deposits of viral-sized particulate into your airways where it would infect you more easily. So there you go. And maybe that's why we're seeing another massive spike, but not really, because this is nature, this is normal, this happens every single year. The science has already told us that. So if you watch and pay attention throughout this entire video, you will see that this second wave of coronavirus should come as no surprise to anybody who's actually paying attention to the science. So, but I am going to give you this. The CDC has admitted, probably inadvertently, that if you've already tested positive and had coronavirus, then guess what? According to them, then you've already been doing your public service by allowing for better herd immunity. Thus, you can't spread it. According to them, watch, here we go. CDC's own Facebook page says this. How many people, they pose the question, how many people need to get the COVID-19 vaccine for herd immunity? How many people need to get the COVID vaccine? Well, let's explain herd immunity, they think. When enough people in the community are protected from getting a disease because they've already had the disease, what did they say? By already having the disease, or they've been vaccinated. All right? That is to assume that a vaccine actually prevents you from contracting the virus and then spreading it to others, which I'll show you multiple studies, some of which were actually funded by the CDC themselves, or the FDA, that have actually shown that certain vaccines, such as the influenza vaccine and the whooping cough vaccine, actually increase viral aerosolization with the flu vaccine, and also respiratory pathogen transmission, the spread of the bacteria that causes whooping cough because of the vaccine, because of the distortion the vaccine causes in normal, natural, healthy immune responses. And it actually increased the infant mortality rate then after that as well. Again, I'm going to show you the science, so just hang with me here. So they say, if you got the disease or they've been vaccinated, that makes it hard for the disease to spread to person. This is known as herd immunity and even protects those who cannot be vaccinated, like the newborn. So if you've already gotten the disease, you're already protecting the newborns. You're protecting the susceptible, according to what the CDC is saying here, of course. But I will admit, if you read the science, which the vaccine has not been shown to be able to prevent you from what nature has shown us to be evident, is that year after year, just like the influenza virus, people are going to be catching coronaviruses year after year throughout the winter months. There's always a wave. And again, the science was extremely clear on that back in 2017-18, and 18 was when that published study was done. If people be paying attention to the science, this wave would be in no surprise. But this wave also shows that we've had mask mandates in Tennessee this entire time, and we're still seeing the rise. And we are the highest, according to our officials, we're supposed to be the highest per capita in the world, I guess. I've seen claims that in the world, Tennessee has the worst per capita case rate of COVID-19. We had mask mandates, but places like Haiti don't, and they aren't seeing the rise like we are. It's funny how places that don't mandate the masks aren't seeing the increase in COVID-19 case rates, but the places with mask mandates in place are seeing the case rates skyrocket. Maybe they should read that science that I just talked about where the masks actually increase the deposition of viruses in your airways, thus increasing your risk of infection. But since that was new, they probably haven't. But begs the question here. Simple question. If places that aren't mandating masks are doing better than Tennessee, where a lot of our counties have mask mandates, how's the masks working out for you? And I'll tell you, it's pretty much the definition of insanity. They've reinstituted these orders, quote unquote mandates, that don't carry the weight of law, because law has to go through Congress, which this mandates have not. So the reality is, they're insane. They are insane. They are expecting a different result. They're expecting masks to suddenly work when common sense shows us they don't work. So, but again, folks, if you have not gotten the vaccine, but you've gotten the disease itself, according to the CDC, if you've already had the disease, again, it says it right there, if they've already had the disease, then you are contributing to herd immunity, and congratulations, you are doing the community a service, and you obviously don't need to wear a mask. But anyways, let's go on with it. We'll read through it, the rest of it, in a little while. So here's the study I was referencing that was funded by the Food and Drug Administration, by the FDA. It was actually a baboon study, okay? Baboons vaccinated against acellular pertussis. They were protected to some degree against severe symptoms associated with the colonization of Bordetella pertussis in their lungs. They did not deer the infection faster. They did not clear the infection, yes, because of the image. They did not clear. You can't see the space between the C and the L. That's why it said it looks like a D. Excuse me. I rhymed anyways. The infection faster than naive animals. So they didn't clear the infection faster. Actually, it was a couple days longer if you actually read through the entire study. And they readily transmitted the infection to the unvaccinated contacts. So they infected others despite being vaccinated. Also, infectious virus exhaled breath of symptomatic seasonal influenza cases from a college community. Again, Maryland Institute of Applied Environmental Health, School of Public Health, University of Maryland, Department of Chemical Bioengineering. So I don't see the CDC on this one, but let's watch. Look at this. Their adjusted models, we observed a 6.3 times more aerosol shedding among cases with vaccination that were vaccinated in the current and previous season compared to having no vaccination in those two seasons. So who spread more virus? This is not the virus the vaccine gave them. This is not the virus that was injected, so it's different than the shedding of the virus you received from the vaccine. But this was when they caught, thus they didn't prevent the infection, but because they received 2 consecutive vaccines, it distorts the immune system, which we could go all through the science, and I have in the past. Go to thewilddoc.com and watch my 3-hour video that I did actually several years ago on tons and tons of science of how it's a joke that they promote the influenza vaccine as effective. And you also find their research that shows that the coronavirus infections are at higher rates in those who get the flu vaccine. But side note on that, but you can reference it from there. 6.3 times more aerosolized shedding. Again, what can you do to help? This little, what should we name her? Why is it a female? I don't know. Don't know why. Don't know why it has to be a female. Name him, her, whatever. If you want a girl humidifier or a boy humidifier, it doesn't matter. Or if you want a humidifier that doesn't identify as a boy or girl, I guess you'd have that too. Okay, I shouldn't have gone there, but anyways. Humidity helps to allow for, what humidity does, since I'm going to go through this right off the bat, what humidity does is when you aerosolize a virus, you're breathing it out. You're basically just breathing out the virus particulate. And the virus is floating in the air because it's not heavy enough to fall to the earth. So it stays in the air for hours upon hours. And if the air within your home or within your building, especially during the winter months, when we're running our heaters, it dries out the air. And if you dry out the air, guess what? There's no humidity droplets there that will actually connect and bind to that virus in the air and allow it to fall to earth faster, thus less chance for people to breathe it in. So by having humidity in the air from 40 to 60 on the little humidity gauges, guess what? You reduce the aerosolized viruses in the air on surfaces as well, which is very unique surfaces, and the infectivity, the ability for the virus to actually infect. So somehow humidity reduces the capability of the virus to infect you even once the virus binds to it and falls to a surface. Really cool stuff. So this study, in fact, on humidity was done back in 2013, but we've not instituted or done more studies to broaden the understanding of effectiveness of this little machine right here and institute it in all of our school and classrooms or communities or churches and different places to reduce the risk of influenza and other aerosolized viruses. You gotta ask, why not? Really? Why didn't they decide to do this back in 2013 when this little machine right here and keeping your humidity up within your classrooms in different places could have been reducing the risk of infection in those situations and facilities, gatherings, would have been reducing people from falling ill, would have been saving lives in essence. Why didn't they want to do that? I wonder why. Why did they keep promoting a vaccine for influenza that really, when you study the science, doesn't have as much benefit as this right here with lots of side effects? Anyways, let's go on. Like 6.3 times more aerosolized shedding if you get 2 of them. Wearing a mask could be actually worse than no mask amid COVID-19 study. Wearing a used mask, they say, because what they did in this study, if you actually read the actual trial and the published literature, you actually find out that they assumed, and you know what you get when you assume. I want to remind everybody that I don't cuss on here, so I'm not going to remind you. But here's what they did. They actually assumed that the mask was 65% effective at filtering out every single size of particle. Every single size. Holy cow. There's no scientific literature out there that you can just assume that the science alone is ridiculous. The fact that they assumed whether it was 1 micron or whether it was 20, the mask worked just the same for any size whatsoever. 1 or 20, doesn't matter. And there's no, like, if you talk to people that work in the scientific community with air filtration systems and things like that, they will say it can filter out up to this, down to this size. Below that, it really is not effective. And it has an ability with the larger particulates to filter those out a lot better. Like a mosquito that flies through your vent, you know what? If you got a filter on your air conditioning, it's going to catch the mosquito. But something like a virus, no, it cannot. It doesn't do it hardly at all. So they're assuming that it was 1 or 20, didn't matter, 65% of those molecules are filtered out. So their science really is junk in that regard. But by reducing the airflow speed, it actually allowed for more deposits of the smaller micron sizes, like 1 to 3, I believe it was. You can check me on the science and those numbers, but it was the smaller ones. Guess what? They deposit more in your sinus cavities when you wore a mask, just by reducing the speed at which air went in and out of it. So therefore, a mask could actually and would actually be increasing the deposits of aerosolized viruses in your airways, where you would be then susceptible to that virus penetrating your cells and infecting you and giving you active disease. And then you could spread it to other people because your mask still doesn't work. So the Royal Society of Open Sciences says this. All right, implications of asymptomatic carriers for infectious disease transmission and control. Why did I give you those two studies? One on whooping cough, one on the influenza virus, because they actually can reduce symptoms. But even if they reduce symptoms, especially with the whooping cough is a perfect example of this. When you reduce symptoms, what happens? You know, I've given lots of examples of this, but let's just explain it plain and simple. You know, if you reduce symptoms, like taking Tylenol, it's widely known that suppression of symptoms not only increases your likelihood, and again, don't fear the fever, go ahead and watch my videos on my website, thewilddoc.com. And so here's the reality. If you suppress symptoms, one, you're working against God's creation and the body's ability to fight off and defend itself from that viral attack. Well, you need to support the fever, for one. But if you suppress symptoms, what you allow for is somebody doesn't have that check engine light. They don't have a blaring cough that says, hey, you need to actually not go out in public and go around your grandmother or grandfather or your friend who's maybe fighting cancer, God forbid, or the newborn baby. You would stay home and you would stay away from people because you were symptomatic and you knew you were infected. But because of the vaccines that suppress symptoms but don't actually prevent you from getting the virus or bacteria infected within your airways, again, a vaccine penetrates your bloodstream and then gives you immunity within the bloodstream in essence, again, in theory, in reality too. It can help you neutralize the virus within the bloodstream, but yet if the virus is actually attacking your mucosal barrier cells, that's not within the blood, and it takes an IgA immune response, which is not what a vaccine gives you, and that's what the science shows. And so it increases the number of people who don't realize that they are spreading the virus, thus they go around the people who are susceptible, thus spreading it to the susceptible more frequently. And that's why it says right here, these asymptomatic carriers, and again, it's talking primarily about whooping cough. These asymptomatic carriers contribute to the spread of disease, but go largely undetected and can therefore undermine the efforts of control of transmission. So with the COVID vaccine, not actually capable or scientifically shown to reduce your capability of transmitting the infection to other people, only being able to reduce your symptoms, this is what the science currently says. That's why the New York Times says, here's why vaccinated people still need to wear a mask. Because the science doesn't say you be less capable of infecting others. And again, I'll just back it up. Here's a Bloomberg article. Luckily, they're actually telling people that, hey, we still need to control your life and what you wear on your face every single day, and we're going to continue to do what we want to do, even when you get a vaccine. So you're hoping this vaccine allow you to go back to normal, like Fauci is saying? Yeah. Broken promises, promises not fulfilled. Vaccines fight COVID. Do they really? It's yet to be seen. But they do cause anaphylaxis. We're seeing that very regularly right now in the healthcare workers, and God bless their souls. I hope and pray that none of them fall terribly, terribly ill or die. Luckily, they're vaccinating healthcare workers in a hospital, thus they have the crash carts and different things like that to save their lives. But how are they going to roll it out to the public? And all those Montgomery County, training operations they've had, that where you drive through a parking lot and they inject you through the arm. They practice that. Are they going to allow people like that nurse? What if more people have vasovagal syncope where they fall asleep or they pass out because of decreased blood flow to their brain following a vaccine, and then they crash their car and die? What good did you do to them in our community? Really? Are you going to? So they're going to have major problems. But thank God the healthcare workers being vaccinated in the hospital are at the hospital where they can save their life in an emergency situation, like when they have anaphylaxis. So, the irony of it is kind of good, I guess. But can they stop the spread? Trials show that vaccines prevent COVID symptoms, haven't established whether they can prevent transmission of the virus, which is key. All right. And again, this is where the British Medical Journal really gives us a great write-up. We can thank Peter Doshi for that. Will COVID vaccines save lives? The evidence doesn't show us that. And this is where they say, ideally, you want an antiviral vaccine to do two things. First, reduce the likelihood you will get severely ill and go to the hospital, and two, prevent infection and therefore interrupt disease transmission. But they explain that the trials were not set up to show us and prove to us that transmission would be reduced and severe illness would be reduced. So what they're promising people, that it would protect you from getting severe disease or protect grandma or grandpa from getting severe disease, and also they don't take into account that the studies excluded, most of the studies excluded the elderly, the susceptible populations, the diabetics, and others. So because they've excluded those, no one can really say that it's going to protect the people that they're suggesting get the vaccine first. So they're going without science, at least. So acellular pertussis, again, I'm going to reiterate. Acellular pertussis, again, an animal study, but human trials have also proved this. And what's the problem? Just like this, again, if you suppress symptoms but you don't prevent infection, you are not going to protect the susceptible, okay? And the susceptible are who are needing our support. They need to, and I've said this, and this is what people need to understand. Why have we not been working on what creates susceptibility in an individual? If we've been doing that over this last year, things like vitamin D deficiency, zinc deficiency, just plain old nutritional deficiencies, stress, and other things. If we had been working on that, more people would be alive and more people would be surviving into the near future. But rather than doing that, we've spent billions and billions of dollars on a vaccine that the science says probably isn't going to do much for us anyhow. But again, increase in deaths to pertussis among the young infants. Why did I want to reiterate that? Because again, let me go back here, because it's this right here. What did I do? Edit, undo. Sorry about that. Short little. There it is. Because right here it says, if you read that. Anthony, are you able to get back over here and be able to change back between me and the screen? Cool, well I meant to me. But, because I want to point at the screen. Because I want to point out that again, they are saying that herd immunity would protect those who cannot be vaccinated, like the newborns. So because they emphasize newborns is why I wanted to emphasize this study right here. What did they say? Increase in deaths from pertussis among young infants in the United States in the 1990s. Compared to the 1980s, when mothers would have natural immunity and would not have had received the vaccine, the number of infants from the 1980s increased by 52% in infants. Pertussis and mortality rates increased by 44% in infants. Why? Because of natural immunity being superior to vaccine immunity. And also asymptomatic transmission meant that little Johnny, cousins, and family members, even adults that got the vaccine, they are asymptomatic. They believe the vaccine gave them something or gave them the ability to protect their newborn baby brother or cousin from getting a disease like whooping cough. So they got the vaccine with good intentions. But yet what they didn't realize, that asymptomatic transmission is an even bigger threat than symptomatic. Because people who are symptomatic understand they should probably not go around a newborn or a cancer patient. So, longitudinal active sampling of respiratory viral infections across age groups. So this study, the reason I point this out is, again, this is the science that the public should be paying attention to, and it is ridiculous that the scientific quote-unquote experts are not paying attention to. Again, if we look from 2016, fall of 2016, of October, November, December, the red line is coronaviruses. Again, there are multiple different types of coronaviruses. Yes, SARS coronavirus 2 may be more of an harsh virus, may hit people a little bit harder. I'm not downplaying that. But coronaviruses spread primarily from November, starting in October to November, into April and May. Now, these two, because of the low number of total infections and testing, because people were not really symptomatic over the summer months, these are statistical anomalies, they said. The spikes in prevalence of coronavirus in May and July are likely artifacts due to lower numbers of samples collected. So those were percentages. So these were a lot of samples collected, a lot of people getting sick over the winter months like they are now, okay? And they see a spike in coronaviruses. And when did it happen in 2017 to 18? Oh, it happened in October, and then it rapidly increases in December. Holy cow, just like it is now. Well, darn it, why didn't we just tell people that, just like Mother Nature's shown us and the science has proven, coronavirus spread goes up every year? The fact that they don't point this out and they say, we already understand the viral dynamics of coronaviruses, when they spread, when they skyrocket, so they're going to skyrocket. And because they are skyrocketing right now, means the mask doesn't work, folks. Because we didn't prevent the spike that had been seen even in years when there was no mask mandates. But here, look at this. Without even herd immunity, Or maybe we get herd immunity every season, who knows? Or maybe there is a susceptibility risk factors that are environmental in nature, and maybe vitamin D deficiencies that start to increase throughout the winter months because nobody's with their shirt off out in the sun. Nobody's laying out in a bikini. Well, I guess there's probably going to be one lady that says, nope, I lay out in a bikini in the middle of the winter and sunbathe in Alaska, you know. But anyways, so if you want to, don't post pictures or anything like that. I mean, if you want to say, yes, I sunbathe in the middle of winter, go ahead. But again, then you got to understand the trajectory and the angle of the sun and the atmosphere and blocks those UVB rays more during the winter months. But we're not going to go into that all. But again, spike and it goes down. So again, so I'll explain to you what I believe is going to happen and how they're going to deceptively convince people that the vaccine did what nature said would happen every year. All right? Now, I'm going to point out that if you look on the COVID tracking project, U.S. daily tests, COVID daily tests in March, May, June, July, August, goes up, and then it plateaus with the testing rates from roughly July until September. And then in September it goes up, and then, oh my gosh, testing rates go skyrocketing up in October, November, December. So it's funny how in October, November, December, the rates go skyrocketing. But then again, had we looked at the science beforehand, October, November, December, it goes skyrocketing every single year. And again, folks, why am I doing this video? Because if you've tested positive already for COVID, that means you don't need to take the vaccine. But I do want to reiterate that when you look at the allocated plan of vaccines, okay? Here's how they are planning, and this is Tennessee Health Department. So first people to get it will be inpatients, other high exposure healthcare workers, residents and staff of long-term care facilities, first responders. They're going to get the first vaccine. Well, what about all the responders, all the residents, all the healthcare workers? See, if they were actually going about this logically and scientific, they would say this. Well, any healthcare worker, because according to the CDC, remember, they say that anybody who has been priorly infected, prior to this have been infected, that's what they say, because they've already had the disease. So if you've already had the disease, then you have already contributed to herd immunity. So why are we going to vaccinate everybody? They should have a clause down here, an asterisk, that says anyone who's tested positive and already had coronavirus disease does not need to receive the vaccine. Then, if they were going about it logically, they could say of these 450,000 vaccines that somehow we're short on stock and we can't make enough. It's supply and demand, folks. But the reality, it's marketing and it's fear tactics, and it's like the industry needs more money to produce more faster. That's how pharmaceutical companies get their more money. But we could take a bunch of these vaccines because a lot of these people have already been infected and exposed. So then because of that, because the CDC said they wouldn't need a vaccine because they've already contributed to herd immunity, then you could actually say that a bunch of them could go to these people. But then a bunch of these people, like all other healthcare workers who had already been infected, well then they don't need their vaccine. So then we could push more vaccines to the high-risk comorbidities. But a lot of the high-risk people have already got the disease. So then a lot of them wouldn't need the vaccine because they've already recovered from it. So then we can push a lot of those 1.2 million estimated vaccines that were needed, quote unquote needed there, over to here. Critical care infrastructure, school and child care, moderate risk comorbidities, greater than 65 years of congregated care, corrections, and correction facilities, I bet that is. So anybody who's gotten infected there already doesn't need the vaccine, so we push it there. Young adults and children and industry would be here. And then all other people, except those who have already got the virus. Do you get me? If they were going, but there's no explanation in this whole thing, according to what the CDC said, people who have already been infected don't need a vaccine. So where's the logic in this? Is it about selling a vaccine or is it about using science to save lives? That is the issue. That is where they're deceptive. That is where you know what they stand for, what they believe in, what they have faith in, their religious faith is in vaccines. They're not utilizing the science to say what is the most logical way to create herd immunity the fastest. And again, that is theorizing that the vaccine doesn't just reduce symptoms, but the vaccine would actually allow you not to spread the virus. Because if the vaccine just suppresses symptoms, unlike natural immunity has a better capability because the virus, if it comes through your mucosal membrane, through your sinuses and through your airways, that trains your body to say, I need to fight the virus at the front door, if your nose is the front door. Or once it gets in my airways, I need to fight it there. So what's your body do? It produces immunoglobulins like IgA antibodies that would then neutralize it at that level, or it would increase the CD8 T cells or CD4 T cells, the T cells necessary to respond more rapidly when it comes in contact with virus again later, even if you don't have circulating antibodies in your bloodstream. You still have memory T cells that then activate and say, hey, here's the virus. Here it is again. I remember that guy. I'm going to kill him off a lot faster at the mucosal barriers. But a vaccine doesn't train your immune system that way because you bypass all those mucosal systems and you inject it directly into the bloodstream. If I could have a mic drop, I'd do it. Thank you, Anthony. So, leave you with more. Scientists now believe COVID-19 is aerosolized. What does that mean? It means Lysol and all of these hand sanitizers and things like that aren't as important as wearing your mask, according to them. But then it's like, well, masks can't prevent the virus from going through your airways. And again, if you read the study, you will see viral-sized particulate that wearing a mask could increase. Again, but they did assume that a mask could filter out 20 micron size and 1 micron size the same, which no science ever published on air filtration systems would say that one filter filters out every single size particulate. That's like saying that they could filter out, like, if you could breathe in elephants, this mask can prevent you from breathing in elephants at the same rate it can prevent you from breathing in a virus. Because we're assuming this mask can prevent any size particulate whatsoever by 65%. But because it changed the airflow dynamics, changing the airflow dynamics allowed for the deposits of virus, smaller particulate sizes, to deposit more in your airways, your upper respiratory airways, sinuses, where the virus begins its infectious process. So, they argue that, and I reiterate, that masks are not working. Common sense says, again, Tennessee, highest case rate in the world. We've had mask mandates on most of our areas within Tennessee. Places like Haiti and around the world, Sweden, where they don't have mask mandates, they're doing better than us. You are insane to think that a mask is going to do something that it already has proven it incapable of doing. High humidity leads to loss of infectious disease. Let's get our smoke screen back here. Anthony, I'm going to talk. So if we want to talk to each other, we should talk to each other like this. That way, if any viruses are being aerosolized, the humidity is catching them. That's funny to me, okay? Come on. High humidity leads to infectious virus, loss of an infectious influenza virus from simulated coughs and other things. Maintaining indoor humidity at greater than 40% will significantly reduce the infectivity of aerosolized viruses. One simple PDF, Dr. Steam. Dr. Steam. Get it? Get it? Steamy? Yeah, anyways. It's not Dr. Dreamy, it's Dr. Steamy. Okay, I'm sorry. I'll stop. Humidity to reduce. And this study was published when? 2013. Why have they, if it was about saving lives, if science and health institutions, if health departments, if the CDC was about saving lives and saving money, they're not. Then they would have been implementing this science. I mean, it was a huge, I mean, big. Doesn't Donald Trump do that? Huge. It's huge. Again, I'm not getting political, but the reality is, do that. Think about this. It was like 1/3 or something. It was ridiculous how effective this was. Why don't we do that for our schools? Why don't we do that in every single classroom? Why don't we use what we have? Why weren't we using what we had? The fact that they ignored the science that says we could have been reducing viruses with something as simple as that, not forcing people to be at greater risk of infection because of masks. If we would have been doing this, we could have been reducing the transmission. We could have been reducing that. But again, it all is going to come down to decreasing your susceptibility, decreasing your grandparents' susceptibility. And the susceptibility risk factors don't come about because they didn't get vaccinated. The susceptibility risk factors come because of their deficiencies, because of their medications, because of their chronic diseases that weren't reversed but were simply medicated throughout their life. That is what creates the susceptibility. Let's start reducing the susceptibilities. And if we do that, we will save more lives. We will effectively allow people to live much longer and healthier lives. And so, folks, here's what I want to reiterate right here. So just like this, just like every year, coronavirus infections will go up and they will go down. They go up in November, they decline in April. They go up in October, November, skyrocketing in December, January, and will decline. They follow that very similar pattern every single season. And they will continue to do that year after year after year. And we're not going to be able to vaccinate for every one of them. All right? But here is where the deception will come in. So just like this, and again, you've got to take into account that the rate of testing has skyrocketed. Thus, if you're looking for something, so will the rate. But they already knew that it was going to go up. It did this every single year. The cases here go up every year with coronaviruses. But now, it's here. It's probably reached near its peak. And it will go down. And they will say, oh, we're at our peak. It's always at its peak during this time period. All right? But they will say, just like Governor Bill Lee said, let's mandate the mask now at the peak, and then it'll fall, and then I'll be like, see, I'm your savior. I mandated you to do the same thing you've already been doing that didn't prevent the spike in the first place, but now that I mandated it and emphasized it more, and because we put signs on the doors, more people wore masks, and look, it declined thereafter. You know, we already know it's gonna decline. It won't take your silly, dinky little face diapers. And what they'll do is the testing rates will go down. The case rates will go down. And guess what? Just like they do every year, it'll hit rock bottom in April and May. But guess what? They've started the vaccines basically here. All right? Now, the rate will go down. And they've already said it's going to take 2 vaccines, and it's going to take a few months, and it's going to take roughly 40 days from vaccine 1 to the last vaccine, and then you got to wait. I forget what number of days, if it's like 7 days that they're saying it takes before you have full-on immunity from the vaccine. So they're going to start the vaccines here, and then we're going to see it decline, and we're going to see it rock bottom nowhere throughout the summer, basically. And they'll say, see, our Savior came and provided us with protection. Thank you for the vaccine. Thank you, thank you, thank you for our golden calf. Oh, you didn't know vaca means calf in a different language. Yeah, it does. Cow. That's what they're going to say, folks. We won't need a vaccine. We don't need one. We need to reduce people's susceptibility to every single infectious disease. And something extremely simple that I've already talked about, we could have been for years utilizing the science on vitamin D, zinc, and other essential nutrients your body needs. Something as simple as that anybody and everybody can get their hands on practically. If we had been doing that for the years since the studies showed that zinc reduces all-cause pneumonia in healthcare, long-term healthcare facilities. They never implemented mandated zinc supplementation in every single nursing home out there. So more people died over those years. More of your grandparents have died because they didn't care about the science of saving lives. They cared about the science that only promotes their products. Folks, they didn't care that vitamin D science has already shown that 30% of respiratory illnesses and deaths could be prevented by getting adequate vitamin D in the bloodstream of everybody in the world. 30%. There's no vaccine that could come even close to that. Because even if we remove one virus from this earth, we still have all the other viruses that will take advantage of the susceptible. We have to focus on the susceptibilities, and we will save lives. But listen to me. What is going to happen also because of this video and you guys sharing this and educating your family and friends on the fact that if they get adequate vitamin D, if they get adequate nutrition and zinc and all the other minerals and vitamins and things that they need to support their natural and healthy immune response, well, then the case rates are going to go down. The death rates are going to go down because of that advice and that information that you're receiving right now. But who's going to take credit for it and promote the supposed effectiveness of their vaccine? You know it. You know they will. Because that's exactly what they've done every single infectious disease. They implement vaccines once the decline had already occurred, once the death rate had already occurred, and then make claim that their vaccine caused the decline that had already occurred. And I've gone through that in the past. I'm not going to go through that right now, but I want you to take this information. I want you to be equipped with this information. I want you to call it out and show your doctors. I want you to email. This is the call to action today. You will get this, all right? Again, once we get all the files uploaded onto the website, thewilddoc.com, if you subscribe to the email campaign there, if you subscribe, you'll get an alert when this video is on YouTube and then on our website, which then will give you all the lists. And are we doing any of the texting and stuff like that? If you want to be alerted, you could text stuff, right?
Yes.
So Anthony's going to give me the phone number. But if you took this one thing, talking to your legislators maybe, talking to maybe if you have the opportunity, you aren't barred from harassing your local health department directors about ways you could reduce infections naturally and healthy without vaccines, well then you can go and talk to them about this nice little machine here that science has created and that's capable of reducing infectious viruses aerosolized in classrooms and other places. If we would talk to teachers and school boards, maybe we would just be able to say, why haven't they implemented this already? Why don't we implement that right now? Why don't we give every single teacher all the vitamin D they need, and let's monitor their vitamin D levels throughout the winter and make sure they got adequate levels that show that once they get up above 30 and 40, their risk of COVID-19 is basically zilch. But we're not doing that. But we could be. So let's start doing it. And I call upon the people who are supposed to be the experts and the authorities and the task forces who aren't doing this. If you don't start doing it, that's going to show the world that you really aren't caring about utilizing the best available science to do what could actually work right now, the here and now, to save lives. Instead, you are promoting the idea that mask until there's a vaccine. Now it's mask until you still get a mask after the vaccine. There's no excuse anymore. There's none whatsoever. This is why I point this stuff out. I hope you're equipped with it. I hope you share the video. I pray to God we don't get censored. But if we do, do your best to tag a family member, a friend, tag your wife, tag your friends, tag your kids. I'm sorry. Does anybody else? Every time I say that, call to action. Tag your wife, tag your kids, tag your neighbor. You know, I just get so worked up because the reality is I thank God for the healthy community that I get to create within my office and within the people that I get the opportunity to get my voice out to. Again, we've been implementing things that have been successful throughout this year. of reducing illness, reducing severity. Not a single patient. I, in fact, had one patient doing healthy lifestyle things, supplementation and things like that I wasn't even doing for the prevention of COVID, but I was simply doing to help her be healthier. Her and her roommate both got COVID. She spent a day and a half running a fever and got over it and was back to 100%, but still had to quarantine. Her roommate, who was quarantined, wasn't doing the same things, wasn't guided by somebody about health, took 8 days and took fever reducers, Tylenol and other things the whole time, and had a horrific time with it. But fever reducers are what the health department tells you to do. It's ridiculous. So folks, again, I'm sorry I get rambly, and I don't even know if rambly is a word, but I made it up and it is now. I ramble on a lot, and it is because I couldn't say this loud enough, long enough. Because it seems like authorities don't really care. Because if they ignore this stuff, if they ignore strategies that are safe, extremely effective for multiple different respiratory viruses, so we'd be saving lives from every single infectious disease that causes respiratory and pneumonia issues. They're ignoring science that says we could have been doing this for the last 7 years in reducing the spread of any and all viruses. Instead, they promote their drugs, they promote their vaccines, and they push their masks and mandates. I think that speaks volumes to what they really care about. Because this isn't profitable. Well, I mean, maybe they could invest it, and trust me, I have no stock in humidifier companies. I don't sell humidifiers, so there you go. I make nothing by telling you this information right here. But again, it's about money. It's high time that the people, the community, everybody realizes that. If we can see them for what they're really truly trying to do, which is to profit off of the death and illness and susceptibility of people, they're profiting off of the susceptibility while not correcting the susceptibility. And that is wrong. So folks, share the information. Subscribe to thewilddoc.com. Help me end the spread of misinformation and the spread of non-use of science. I could go on and on and on. Love you all, appreciate you all. I'm signing off.